I want to welcome everyone to our informational hearing of the Assembly Committee on Military and Veteran Affairs. Before we begin, I'd like to make a statement on providing testimony at the hearing. We seek to protect the rights of all who participate in the legislative process so that we can have an effective deliberation on the critical issues facing California. All witnesses will be testifying in person, and all testimony comments are limited to the topic at hand. Today, we have a hearing that focuses on the benefits of military veterans that they have earned through their service to our country. These men and women have risked their lives to keep us safe, and now the benefits they're owed are being stripped away. And many more are in jeopardy due to our current administration's recent cuts, as well as the plans made public by the administration for further devastating cuts. Oh, you know what? And we're called to order. Sorry, my first hearing of the year. Actually, since we have an introduction and it's the first hearing of the year, I also wanted to make a comment. This is the first time we have had an all-woman leadership of our committee, which is why we were taking a picture earlier. So I just want to acknowledge that is a momentous occasion, and very proud to work with these amazing women on this important issue. So with that, we know that all Americans are affected by the federal cuts, but these budget slashing cuts have been especially hard on those who have served in our military. Employment, healthcare, housing, jobs that sustain families, and much more are on the line for veterans, especially because many of those who return home continue public service as government employees. To compensate for the economic loss of serving in the military and acknowledge the difficulty service members face in transitioning the skills gained in the military to civilian jobs, or to navigate employment with disability resulting from their service, veterans are given preference for government hiring. That's why nearly a third of our federal workers are veterans, half of which have a disability from their service, and that's why these drastic cuts are cuts to a federal government workforce that have disproportionate impacts on veterans, leaving thousands of veterans jobless. Cuts to the federal workforce are also affecting medical care for veterans. The Veteran Health Administration workforce constitutes 90% of the VA's workforce. So cuts to the VA means cuts to healthcare, including mental health care, which I also just today was hearing reports of at one of the VA hospitals. Plain and simple, these are cuts that are devastating to veterans. Some of you know that just a few weeks ago, my dad passed away from health issues relating to his military service. He battled cancer 3 times, cancer that he got from exposure to Agent Orange when he was in Vietnam. It was the healthcare of the VA that saved his life. More times than I can count at this point, and it kept us from becoming homeless, because if we had had to choose between his care when he first got cancer and paying the mortgage, we would not have been able to do both. The VA gave my dad 40 more years of birthdays and anniversaries in our family. These are years that my parents just celebrated their 50th anniversary, and he saw his children have children, and we had Thanksgivings together. And it's people like my dad who served and were exposed to cancer-causing toxins like Agent Orange, who are no longer assured the care that they need. That's why I was so overjoyed to see that a couple years ago, the VA has served over 1 million more veterans and their survivors due to the expansion of care under the PACT Act. This includes expanded eligibility for former service members who received VA health care for things like exposure to cancer-causing toxins like Agent Orange, which is how my dad died. Exposure to toxins from burn pits. And so since this was enacted in 2022, more than 5.6 million veterans have been screened for toxic exposure under the PACT Act. The administration's proposed 83,000 cuts to staff will make it much more difficult for the VA to provide health care to these newly eligible veterans. It's really, Orwellian doublespeak to say that you are prioritizing services to veterans and veteran care when at the same time you're cutting the very staff that provide it. In cuts to social services and counties' veteran crisis lines losing employees to layoffs, around 900 of the 1,130 crisis line workers have always worked remotely. So ending that remote work means further undermining staffing. Current data shows that an average of 17.6 veterans deaths by suicide per day. We're losing 17 veterans a day just by suicide. Deaths by suicide remains the second leading cause of death among veterans under 45 years old. And limited access to veterans' crisis lines due to layoffs will have dire impacts for veterans who are seeking support in their most critical time of need. With overall budget cuts to the VA and federal workforce reduction, at least 350 VA researchers will likely lose their jobs. Stopping their life-saving research will harm veterans' well-being and compromise the medical community's understanding of substance use, mental health, veteran populations, and critical insights from VA research on cancer prevention and treatment. Numerous reports indicate that there will be drastic cuts to safety net programs, including food stamps and Medicaid, which is called Medi-Cal here in California. And cutting Medi-Cal will hurt veteran health, as not all veterans can access the health care that is provided by the VA. Estimates show that over the past decade, nearly 10% of veterans use Medicaid, and at least some of their health care benefits, and 40% of those veterans rely exclusively on Medicaid for their health care. Additionally, 1.2 million veterans rely on SNAP, or CalFresh in California, for food assistance benefits, with working age veterans at higher risk for food insecurity than their non-veteran counterparts. Many veterans did not have the money to make up for these cuts, and so these cuts literally mean cutting veterans' ability to put food on the table. California has made significant strides in supporting veterans. In the last few years, we've had the largest decrease in veteran homelessness, outperforming the national average by double digits. California is working smarter by combining permanent housing with supportive services, including mental health care and substance abuse treatment for veterans experiencing or at risk of homelessness. The Veterans Housing and Homelessness Prevention Program has helped create nearly 7,000 units of affordable veteran housing. Now is when the time we need to expand on the progress that we have made, not let the careless decisions made by the federal administration erase our progress and send us backwards. I'm eager to hear from our panelists today so that we can all learn more about the impacts of federal cuts and help focus on the work ahead. Our first panel is the California Military Department. I would like to welcome up the Adjutant General, Major General Matthew Beavers, as our first witness.
We've started to plan things around an expectation that the government will shut down. We continue now to plan things, assuming there'll be a continuing resolution. So we try to front load as many contracts as we possibly can. And then we try to be very, very proactive at securing federal resources toward the end of the federal fiscal year, because the way it goes now, it's so hard to spend that money. If we can tee things up and be ready to go, we can secure some of that federal funding and then either obligated or executed within the year of execution to help our soldiers and airmen. But it's a challenge. These continuing resolutions are insane.
And I know, I mean, I think that speaks to the readiness, discussion that you're having, is if you're having to now shift your focus to all of, spinning your wheels and trying to hurry up and make sure you have the funding you need and make sure the equipment that you need is there, then just in terms of human capacity, right, you're having to prioritize that over other things that may need to be done.
I think 89, last time I checked, 89 executive orders, about half of those affected the military department. And every one I would characterize it as a significant emotional event for my staff that has to go through it and make sure that we're following the rules to the letter.
Right.
It's important, I think, for folks to recognize that while the National Guard, the governor is our commander-in-chief, right? The deal is that for all the military equipment and all the training and all the expertise that come with being in the National Guard, the deal is the federal government gets to determine the standards and all of the things that you do. So I want to make sure everybody understands that we're compelled to follow the federal rules in almost every case. So I think that's important for folks. It's more of a civics lesson on how the Constitution and the enabling legislation that created the National Guard as it is today, that's very important to understand.
The challenge, I think, is that it's not just the VA, obviously, that impacts veterans, right? It's could be HUD, to pay rents for veterans. There's a number of different departments and their funding that can impact it. And what was the reality that you were looking at if these programs, these funds disappeared?
Well, very seriously, we look at what our cash flow is at the time and how long we can sustain operations. Is it 60? Is it 90 days? And what do we do with the 3,500 veterans that are sleeping in beds that we're, facilitating across the country? So it was a very terrifying moment and one that's difficult that we still look at, which is why those immediate measures were taken to keep every penny in place where it is right now in case we do have to do something like that. So, yeah, it's very insane, crazy. And it, ripples from us into the veterans we serve and into the employees that are trying to serve the veterans.
It was especially not lost on me when you mentioned that, removing care is life-threatening. I know, at the end of my dad's life, he really needed all of those appointments he was going to. It was critical to, making sure that his lungs didn't fill up with water or fluid.
Sure.
And so to miss those appointments is absolutely 100% life-threatening.
That's why I think that VSSR program is important, because it recognizes that you can't just do wellness checks. You have folks who are seniors who really are struggling to break out of their isolation. They have no sense of community. If you're homeless, it basically means you don't have much family. You don't have any caregivers, in other words, really. And so it's really important to us to have folks who will drive folks to their appointment, help them with groceries, pay attention, connect them with their community. And that's life-saving, really.
Okay. Well, I really want to thank the panelists who are here today. It's really clear from the testimony that we heard that careless cuts by the federal government are already creating chaos and uncertainty for veterans and their families across the country and in California. And what's worse is that plans for additional cuts will cause veteran support programs to close, delays in benefits, and ultimately make it harder for veterans in America. California has made so much progress, as we've talked about today, to support our veterans with access to health care and mental health support, housing, and reducing veteran homelessness by 45%. We really cannot allow these reckless actions to be done by our federal government to stand. And we have to make sure that, what we've already seen from the federal administration back to the budget that could force billions in cuts to Medicaid, Social Security, Medicare, on top of the 2,400 VA employees who've already been fired, and the planned reduction to 83,000 VA employees to be cut. These are cuts that are devastating to veterans who often rely on these programs truly to survive. So, you know, we heard testimony today that talked about, you know, rents that could not be paid if these federal funding is cut. We heard about, you know, agencies that literally question their whole existence and being able to continue to serve the veterans who need them in the community. We, you know, heard how important it is for us to make sure that our voices are heard, that we push back on these cuts. It's, you know, part of why we wanted to have this conversation today, to make sure that it's clear the impact that could be made, and really how the people will be impacted, right? Veterans, everyday veterans who are trying to survive, trying to be healthy. You know, one of the folks on the audience today stated at a previous press conference we were at together about how, you know, 90% of veterans are actually doing great. And part of that is because, a large part of that is because we have these programs, because we have been successful in so many areas to support veterans in getting jobs and getting healthy and accessing mental health and housing, in supporting their families, and in addition to the veterans themselves, and providing, you know, in California, we waive tuition for veterans and family members. That's one of the reasons I was able to get a college education, is because of that. And so, you know, we really have made sure to make these investments over the years, and we cannot see this disappear, this progress disappear. So to, you know, all of those who are here in the room or watching or listening, who have bravely protected and served our country, and to those who love them, we're here to say that we have your back. In the next few months, we will be hearing bills in this committee to provide tax relief, to make housing more affordable, to expand education and job opportunities even more, and extend services. And in contrast to how veterans are being disrespected and disregarded by Washington, D.C., California is here to say that we are open for business, that we are working to protect veterans, and instead of going backwards, California is building upon our progress. You have my commitment that I will fight to fulfill the promises that we have made to those who have served our country. And with that, this concludes the hearing of the Assembly Military and Veteran Affairs. Thank you so much, everyone.